I'm so glad that you're there to kind of, I mean, it seems like you going back to Arizona was kind of a case of you being in the right place at the right time. There was definitely a need for the type of services that you provide, and particularly with the cultural competency and the DEI element. So I'm so glad that, with Aura, there is a resource like that in Arizona, because it was much needed. As someone, I did live in Arizona for 9 years, and there were a lot of things where I feel, they're definitely going to benefit from your presence there and your practice there. So
That's the
thank you
goal.
for that. And uh-huh.
That's the goal. Yeah, no, yeah,
Yeah.
absolutely. I'm on a mission.
Yes, you are on a mission. And it actually brings me to something that we've talked about before. But, obviously it sounds like you're doing a lot of these kind of groundbreaking things, and you're really, like you said, you're on a mission to incorporate things into your practice that are often overlooked or under prioritized in other practices. And so my question is, how do you stay current on all of the latest kind of research and developments in the mental and behavioral health field? And when I say latest research and developments, there's a lot of different things that could mean. I'm particularly interested in things like shrooms and microdosing and all kinds of, you know, alternative therapies and things like that. What do you do to stay on top of all of that?
So, yes, you're talking about psychedelics, and they are making a
Mhm.
comeback. There's so much research that's happening. I I started hearing about the research maybe 4 or 5 years ago, and I continued to just do the research. And now more than ever, you kind of see it everywhere. So, psychedelic assisted therapy is something that I will be doing. My main interest is in psilocybin, which is the active ingredient in shrooms, mushrooms, the magic mushroom. And it is natural. The reason my interest is in that is because it is natural. Right now, MDMA and psilocybin are going through their phase 2 trials, and they're still considered illegal, but they will be legalized. They are on the path to being legalized. Right now, ketamine-assisted therapy is being offered, which ketamine is an anesthetic, and at a lower dose could have psychedelic-like effects. But again, my interest being in shrooms and psilocybin is because it's natural. It comes from the earth. There is no need for anyone to interfere, any lab to interfere. But I will be starting a program. I got accepted into the California Institute of Integral Medicine, and I'm going to be starting in September, to earn the online certification to provide psychedelic assisted therapy. So my goal is to develop a program. So after somebody takes a trip, and that's what they're called, taking a trip on mushrooms, um, the experience that they have, I want to be able to unfold that and develop a program. So I'm going to learn a lot more about the mechanisms of it. Because it's illegal, it's hard to, there's research, but it's coming out very, very recently. And
Mhm.
I want to know just the mechanisms on how it's working in the brain, and what exactly it's doing for people, because it's profound. I think that psilocybin, can allow you to access parts of your brain that you may not otherwise be able to on a normal conscious
Wow.
level. The research has shown that it helps, significantly. I mean, I dare I say cure, addiction. It helps trauma, treatment resistant depression, chronic depression. And so microdosing, taking a trip, those are all different, doses. That's about dosage. But psychedelic assisted therapy is huge, and it's the new horizon. It's the new frontier, that's happening. Johns Hopkins is doing a lot of the leading research in that. And I remember reading or watching a video. I think it was Dr. Matthew Johnson, I believe was his name. He said that one trip, 1 6 hour trip on psilocybin is equivalent to 1,000 hours of therapy. Um,
Wow.
and that in itself is just mind blowing. I was floored when I heard that. And not only that, psilocybin, I believe psychedelics, but I'm going to stick to psilocybin because I know that It's it's pretty safe on a physiological level. It doesn't. There's nothing that it can that it's contraindicated with or that it'll interact with that's known. And so knowing that and knowing the patients that I see, I see patients who come in here and they're like, I've been on this antidepressant for 25 years. It's not working. Probably not. 25 years later, right? So I'm like, let's talk. You have to talk about it. But I think with psychedelics, it's just huge. That is another one of the main reasons why I started Aura,
Hmm.
because I think they allow you to look within yourself, and to be able to make that genuine connection with yourself. So a lot of the approach that I take to therapy, my is mindfulness. So mindfulness means
Hmm.
being in the present moment. So we're thinking about the past too much could lead to depression. You're thinking about the future too much, it could lead to anxiety. But being in the present moment is a practice. I mean, it's incredibly hard to be in the present moment all the time. We would probably be monks if we were, but that practice
I struggle with mindfulness.
well, it does.
I'm always somewhere. It's always the past or the future, but very rarely am I here. Um,
It takes
as much as
practice.
I would like to be present, my mind is going all over the
It
place.
definitely takes practice. So meditation is a good way to practice. Yoga is a great way to practice. So I started these practices because mindfulness can then lead to a state of self-awareness. And self-awareness is a state. And so when you're consistently aware of your emotional state, your intellectual state, your cognitive state, you can respond to the world in a different way. And then when you make it that genuine connection with yourself, meaning when you can trust that no matter what life throws at you, that you're going to be able to handle it. Once you get to that spot, it's like it doesn't matter what anybody says or does, or they can do anything and it will not impact you in any way because
Mm,
you trust yourself. So I believe that psychedelics can get us there on a more profound level and possibly faster, because it
mm,
does take a long time to be able to practice meditation and mindfulness. But ultimately, they end up in the same spot. So essentially, that's how that is from all the patients that have walked into my door, I think that's the one thing that I can tie mostly in common. 99.999% of them have, there is an other, there's something else that's influencing them and that's making them feel a certain way. But your emotions are in your brain. Nobody can make you feel a certain way. You can allow them to, but they can't make you feel a certain way. And if
mm,
you really think about that, that's just, once you understand and realize that, that's just really profound because I don't have to allow anyone to hurt me. Nobody and no nothing, nobody can do anything to change my energy. And so when you connect with yourself genuinely in that manner, then you're just it your energy is positive and you radiate positivity. And that's your aura. And so
oh,
that's why
nice. I see what you did there. Yes. And as someone who basically your life is devoted to, you know, helping others achieve mental wellness, I'm curious, how do you prioritize self-care and mental health for yourself as a healthcare provider
so I
and a business owner?
so has this been a stressful, okay, so let me rewind. Yes, this has been stressful. It's a different kind of a stress though. It's a creative stress. Like if I have I've had maybe like two handfuls in the past like 9 months of creating this, of sleepless nights, where I go down rabbit holes of maybe insurance or whether that's legal stuff or whatever it might be. But I I love what I do. I genuinely love what I do. And so for me, this is not work. I don't consider it
Mhm.
I don't consider it work like many people might consider work. I do know that there have been moments where I'm like, I need to take a break. And so that's where traveling kind of comes into play. But the biggest
Mhm.
thing is dancing. So, like this weekend, I did not do anything, but I heard a song and I was like, I need to choreograph something to this, and that's what I'm going to do. And so that's what I did. Do I have a lot of work? Yeah. Well, I got a lot of work to do
I
starting
love that.
tomorrow, but I'll start that tomorrow. I'm not worried about it because there's always going to be something or another. You know, there's always going to be something
Mhm.
or another. And if you love what you do, then it's just not work. So this is my and this is mine. This is mine now. So and it feels good, and it feels good to be able to, and I feel it just feels good. So I do take the break when I need to take a break. Um, and like I said, I do it with traveling or hanging out with the family, definitely. But dancing for sure. Absolutely.
Awesome. No, and this has been it's so great talking to you. It feels like just friends catching up, kind of us
It's
kind of us if we've gone a while without talking and now we're catching up on all of these things. Um, but I want to kind of end our conversation with a takeaway from you. What is the most powerful thing that you want listeners to take away from this interview?
the most powerful thing I would want anybody to take away ever is to take the time to develop that genuine connection with yourself. I feel like almost hippie-ish when I say it, but self-love, that's real. And so take the time to really love who you are. And if you don't like something about yourself, that's fine, change it. But love who you are, because when you love who you are, that's when it doesn't matter what life throws at you, you will be able to handle it. And so, right, love yourself and respect yourself, and take the time, whatever anybody needs to do that. Whether that's going to therapy to work on something, or it may not even be a problem. People don't have to go to therapy just because there's a problem. You can get a different perspective on something you might be questioning. But love yourself for sure. That's the biggest takeaway.
Well, thank you so much for spending this time with us today. I've learned a lot, even though I've known you for years. I feel like I learned a lot, and you continue to amaze me every time I talk to you. I'm so proud of you, my dear friend.
Thank you
Um,
so much.
but I hope our listeners got something out of this conversation as well. A few different things: respect, humility, self love. Make sure to take care of yourself. There's no mental health without physical health. There's no physical health without mental health. We've got a lot of good nuggets to take away from this conversation. So I hope that you all found it to be valuable. And thank you again, Dr. Raman Sani, for being here today. And if you want to learn more about Dr. Sani's practice, you can find her at www.aurapsych.com, AURAPSYCH.com. So thanks again.
Thank you for having me, Diana. Thank you for having me. I love it. This was great. I love catching up and talking. Thank
You
you.
too. Sending a huge hug. Thank
Huge
you.
hug.
Okay. Bye.
Bye.